It's just a few days away. December the 1st is World AIDS Day, and it's time to reflect on the fact that South Africa has one of the highest infection rates in the world and the most people living with HIV. 20% of HIV positive people live in South Africa, and there are nearly 5 million people on anti-retroviral drugs. Well, today Health Minister Zweli Mkhize launched a new ARV in the Ugu District of KwaZulu-Natal. The fixed dose combination ARV has fewer reported side effects, and it's meant to be more effective. Let's find out more. We chat to Dr. Sandile Buthelezi of the National AIDS Council, who's in our Durban studio. Doctor, thank you for being with us. This antiretroviral is called TLD. Tell us what makes it so special.
Yes, good evening, and good evening to the listeners. This drug it's got fewer side effects, therefore it's well tolerated by the patients. But secondly, this drug it acts more quicker to actually suppress the virus in the blood, so that people who are taking it, if they were unwell, they get well very quickly. But also, once it suppresses, that the likelihood of them transmitting the virus to the other uninfected people are very less. So, but the third part is also the cost. It's very cost effective. It's very good for us because then in terms of the cost, we're able to put more people without the strain on the fiscus. The last one is that the drug is less likely to for the virus to be resistant. So it's actually well tolerated, and it's unlikely that people could become resistant and need to move to the second regimen.
So this is just one small tablet per day as well, convenient. Remind us, how does that compare to what most people on ARVs in South Africa right now are experiencing?
Yes, what we must know is that even the current regimen that we are using in South Africa, for most of the people, they take one tablet. But that tablet has got 3 drugs. What we've done with the new drug that was launched is that one drug that used to create problems for the patients in terms of the side effects, called efficacy, that drug is now going to be replaced by a drug called dolutegravir, which is then the magic drug that we are now introducing. So that will be the difference. So people will still be taking one tablet as they are currently doing, but the one that is coming is got more benefits as compared to the one that people are currently using. Of course, it's got some side effects, just like any other drug, but the side effects are better as compared to the current drug regimen being used. So specifically for women of childbearing age, they need to be counseled to understand that there might be some side effects should they fall pregnant, especially in the first 6 weeks. So there is proper counseling so that they then make a choice and decide if they take the drug, if they're going to use contraception, what kind of contraception they're going to use. But this is not a prerequisite. It's up to the woman. It's a choice for them to decide after being given enough information.
Yeah, and that drug you've mentioned, one of the 3 in the pill, in the one pill, dolutegravir, is apparently a top choice for people in high-income countries. Are we now sort of cutting edge, or can I say it like this, are we giving South Africans the best treatment available in the world?
Yes, yeah, it's a cutting-edge drug, but what has happened is that South Africa has actually negotiated, of course, working with some global agencies to get it at a good price, but to also get some generic manufacturers to actually produce the drug. So South Africans will be getting the drug that is also accessed by people in high-income countries.
Yeah, and it's being rolled out, I understand, on World AIDS Day. I mean, will everybody have access to this, including poor people lining up in public hospitals?
Oh yes. That's why we launched it in Ugu today. The 5 provinces that are going to be the first, of course, include KwaZulu-Natal, Gauteng, Free State, Eastern Cape, and Mpumalanga. But we expect that by the end of February, all the provinces, in all public health facilities, the drugs will be available. What has actually delayed the other provinces is actually ensuring that healthcare workers are actually well trained on the use of the drugs, and also to be able to impart the right information to the people, specifically the people that need to make a decision, especially the women of childbearing age.
You've mentioned healthcare professionals, and I want to raise something else. Let's look at the bigger picture. A while ago, I was speaking to the health minister, talking about some of the problems that people living with HIV have. Some of them not going to fetch their medicine because they're tired of the nurses shouting at them each and every time or each and every month. Do we still have those side issues? Let's look at the bigger fight against AIDS right now and talk about those attitudes specifically.
Yes, what we've actually done as government is to actually try and assist the healthcare workers. We do understand that the healthcare workers, they work under difficult circumstances in different facilities, overloaded facilities with the infrastructure. Of course, government is attending to that. However, that is also not an excuse for us as healthcare workers to actually ill-treat or mistreat the people that come to our facilities. But what we can say is that government, for all the stable patients, government has actually now made arrangements that people who are stable can actually be picking up tablets from some of the private pharmacies that we have signed agreements with, but also we've arranged for some of the community centers and also working with areas where people can access and be able to just go and pick up their tablets if they are stable, and they only probably go once in 6 months into facilities where they can get their bloods done, so they don't have to be meeting the healthcare workers quite often. So this is all what the government is trying to do. At the same time, trying to ensure that we teach our healthcare providers, but we also want the communities to understand that healthcare providers are from the communities. So we need to actually ensure that they are part of the communities. We also do assist them to function and actually be able to treat us as patients in a particular way.
How would you rate the state of South Africa's response to the pandemic right now?
Yeah, South Africa is actually responding very well to the pandemic. Actually, if we look at the most important part, which is treatment, which is prevention, we've been able to cut the infections by 40% using 2010 as a baseline. Though we are supposed to be around 60% if we are to reach our targets of 2020 by December, we are doing the right thing, albeit not in the right pace. So we just need to now quicken the pace to ensure that we are able to reach the targets. So we are doing well there. But secondly, the other part is what we call 90-90-90, which is 90% of people who are HIV positive must know their status through testing. 90 people of those who are tested must be on treatment. 90% of those treated must actually be virally suppressed. It was not just random that we went to Ugu today. Actually, Ugu District has reached the 90-90-90 together with Mzinyashti District in KwaZulu-Natal, together with Kanyagute District in KwaZulu-Natal. But also, we also have some pockets like the city of Eshowe in KwaZulu-Natal where they've reached these targets. These are very important. It's not just the numbers, but these are life saves and potential lives to be saved. So we are actually on the right track. We've actually reached some of the global targets quite in advance because these targets are for December 2020, but some pockets in our country have reached them by actually a year before the actual target date. So we are actually moving in the right direction, albeit of course we are not as fast as we want to be because we carry the most burden in terms of the epidemic.
Indeed. Well, thank you for that discussion. The new drug available from the 1st of December across 5 provinces, he says. And of course, that is World AIDS Day. So we'll be looking at the pandemic much more closely in the run-up to that. The CEO of the South African National AIDS Council, Dr. Sandile Buthelezi.